COVID-19 cases are on the rise in more than a dozen states, but the White House task force chief drew fire from the president for issuing a dire warning.
President Trump accused Dr. Deborah Birx of caving to the Democrats. KCAL9's Tom Wade is live now in the newsroom with the latest for us. Tom?
Hi there, Juan and Pat. Well, the president has criticized and even attacked Dr. Fauci online, but until now he's left Dr. Birx alone. But after she reported surges of the virus in parts of the country, the president hit back.
I told Dr. Birx I think we're doing very well. She was in my office a little while ago. She's a person I have a lot of respect for.
President Trump tonight responding to questions about why he attacked his coronavirus task force coordinator, Dr. Deborah Birx. Dr. Birx over the weekend issued a dire warning about the spread of the virus.
It is extraordinarily widespread. It's into the rural as equal urban areas.
President Trump in a tweet accused Dr. Birx of bowing to Democrat House Speaker Nancy Pelosi, saying Dr. Birx took the bait. Pathetic. Despite evidence supporting Dr. Birx's claim, Mr. Trump today said the opposite is true.
The virus is receding.
Jessica Levinson is a professor at Loyola Law School and hosts the podcast Passing Judgment.
My impression is that the president really rewards loyalty, and Dr. Birx has been pretty loyal. So unlike Dr. Fauci, who has had public breaks with the administration and has therefore been criticized by the administration, Dr. Birx has walked this really fine line between trying to provide scientific information and then at the same time not openly criticizing the president.
The president also continued to defend hydroxychloroquine, a controversial drug he took earlier this summer that many experts say poses health risks.
Many doctors have come out strongly in favor of it. They want it very badly.
That contradicted another task force member, Admiral Brett Giroir, who said the drug has been ineffective in treating COVID.
We don't recommend that as a treatment.
Dr. Fauci has also repeatedly warned against its use.
And hydroxychloroquine is not effective therapy for COVID-19.
This is such a statement on where we are, that we are politicizing whether or not a drug works. We're politicizing whether or not to wear a mask. We're politicizing whether or not we should socially distance. This is not the way we used to be.
Across the country, videos of parties with dozens of people continue to surface as top medical experts continue to raise the alarm. The virus is surging in some spots.
What we're seeing in some of the yellow states and other states is that same insidious increase in percent positive.
Dr. Fauci says states that are seeing a spike in cases may need to pause for a bit.
You may need to drop back a little bit. I don't think you necessarily have to revert to going all the way back to closing.
15 states and the District of Columbia have seen an increase in COVID-19 infections. Here in California, COVID cases and positivity rates are plateauing, even though the single-day deaths have jumped.
We're cautiously optimistic that we're getting back on track to slowing the spread of COVID-19.
Local and state officials attribute the more encouraging numbers to people more strictly following the health guidelines, staying apart and wearing a mask.
And the number of new cases each day has also come down, and it's now below 3,000 cases.
Across the state, the governor says COVID cases are down 21.2% from a week ago. The 7-day average is slightly more than 7,700. The positivity rate for the state dropped to 7% over 14 days and 6.1% over 7 days. LA County is still one of 38 counties on the state's monitoring list. Also, Ferrer today says contact tracing has been challenging because people are fearful about sharing personal and health information. Reporting live in the newsroom, I'm Tom Waite. Juan, back to you.
Tom, thank you.